Hi, my name is Ogbonna Olelewe. This video presentation is for my signature assignment for course NURU 645, which is a evaluation summary of my clinical experiments, my clinical experience. I'm sorry. The best and worst experiences that I had during my clinical experience. Um, I learned how to manage and control disruptive behaviors in dual diagnosed patients with mental retardation, now classified as intellectual disability and other psychiatric issues, using proper medication management. What's the experience that I had during my clinical experience is also in treating dual diagnosed patients with alcohol and drug addiction and other psychiatric diagnoses. These patients can be very disruptive, non-compliance with their medication, and even started fight with my precepting supervisor, getting to the point of having to pose a threat to my treating supervisor. I was very scared, intimidated, and afraid of my life. In one of the instances in which one of the patients tried to get into a fight with my supervising preceptor. Which preceptors did I learn most from? I learned a lot from my supervising preceptor, which is Dr. Hannah, my precepting psychiatrist. My experiences with psychiatric medication management indications have exponentially increased my likeness for psychiatry. He taught me when to use and what different psychotropic medications meant to be used for. I also learned more about psychotherapy with the licensed clinical social worker who devotes more of her time in teaching patients on coping skills. I'm completely satisfied with the clinical experiences gained during my clinical rotation. I developed symbiotic ways to help patients develop insight and solutions to their problems using individual psychotherapy and medication management. Um, Provide objective comments about my facility and my preceptor. Would I recommend them for future students? Definitely yes. I would recommend the facility and my preceptor to future students. The facility is well organized, patients are respected, and patient information is well protected. Short and limited waiting time. My psychiatrist preceptor is very empathetic, and he listens to patients and their concerns. I would strongly recommend the facility and preceptor to future students. Um, I had the opportunity to experience proper medication management, psychotherapeutic approach and methods, indication for psychotherapy uh, alone, pharmacological management alone, and also a combination of both the pharmacology and the psychotherapy. I have always wanted to experience electroconvulsive therapy used in refractory schizophrenia and depression. But unfortunately, the clinical site did not offer such experiences. So that was one of the experience that I would like to get, but I wasn't able to get that. Describe the facility and the type of work they do. It is an outpatient psychiatric clinic which focuses on medication management and psychotherapy therapeutic interventions. The preceptor, my preceptor, who is a psychiatrist and also the owner of the clinic with over 25 years of practice in psychiatry, endowed with experience, his hands-on and teaching style, and enjoys to teach students. Provide a discussion of the overall experience with the patients. My overall experience with the patient is very positive. Majority of the patients were very stable on their medication. They were just coming in for therapy sections and group sessions and medication refills. Only a very small percentage needed more in-depth medication adjustment to control their psychotic symptoms. Did your preceptor allow you to run the sessions? Definitely. I also increased and heightened my quest of becoming a psychiatric nurse practitioner. I saw patients on my own, diagnosed and provided a treatment plan, then was approved by my preceptor, and even I was also allowed to run therapy sessions and groups by myself. Do you feel that you learned any of the business aspects of becoming a PMH MP from your preceptors? Do you feel you understand the billing and coding? Um, I did not learn much about the business aspect of becoming a psychiatric mental health nurse practitioner from my preceptor, though my clinical experiences have been challenged and I learned a lot. I still need more learning to do in terms of the business aspect of becoming a psychiatric nurse practitioner and running a business. I kind of understood the billing and coding, but still need some strengthening in this area of practice. The role changed to being able to do therapy sessions as a psychiatric nurse practitioner as opposed to family nurse practitioners who don't do who are not allowed by their license in the state of California to do therapy sections and groups. Yes, I kind of feel ready to start my new role as a PMH MP, but I still, like I said, I still have a lot to learn as I go along, especially in the business aspect of practicing as a PMH MP. How are you different? What has changed about me? How will I approach with patients? How will my approach with patients be different? Has the population of patients that um, you thought you would want to work with change? The truth of the matter is nothing has changed significantly about me. I have always been and will continue to be a great provider who listens, very empathetic with the patient, pay attention to details, and tailored the treatment plan to the specific treatment because every patient should have their own treatment plan in order to get them to function at their most highest level of functional standing. Um, yes, definitely. Becoming a psychiatric mental health nurse practitioner will change my patient population. Going from a family nurse practitioner to a psychiatric mental health nurse practitioner. Definitely, I would like to. I will start seeing more psych patients, and in doing so, I have to imbibe empathy, direct approach, and most importantly, in seeing mental health patients, one needs to set limits. That way, you don't cross into a personal lives and stuff like that. Well, thank you very much. This has been my experience in the NURU 645 signature assignment. It was actually a very great experience. My preceptor was awesome. He gave me a time to see the patients and come back to him. We go over the cases, and he was very receptive to my questions. So I strongly do recommend future students in having to get their preceptorship done with Dr. Hannah. Thank you so much, and I appreciate your time. Thank you. Bye bye.